All right, welcome everybody to our January 19th, 2021 ASSP Cascade Chapter meeting. Thanks a lot everybody for joining. Glad to see you in our new year and our certainly exciting times that we're experiencing right now. So starting off the meeting today, just a short announcement about some future chapter business. We have our spring rock coming up, and that is going to be April 16th. So that's an opportunity for our executive team to meet with other area ASSP leadership, talk about future goals that are being set, and future planning for our strategic positions. So otherwise, Christy Hayden had another announcement for us today, and then on to our speaker.
Hi, I'm actually wanted to make the announcement on behalf of Thomas Price, who, if you're looking at the video, you can see Thomas there in his green face covering with, it looks like a surgical mask behind it, and he is located at the City of Eugene's Personal Protective Equipment Distribution Center for small businesses that are in need of additional PPE. So Thomas will be placing some information in the chat. So if you have not taken advantage of that and you need some PPE, please reach out to the group. My understanding is we have an overabundance of PPE, so do not go without. Thomas, is there anything you wanted to add?
Nope, that's all. I'll make sure our Facebook page has the link to the city's request, but they'll be doing this for probably most of the month.
Excellent. So Thomas is talking about, there's a Facebook page for the Cascade chapter of the ASSP. So if you're not, haven't joined that group or haven't liked us or followed us or whatever you do on Facebook, you might do that. So you'll see current events as Thomas populates them. Or if you have ideas, we're certainly welcome to add those as well. Are you ready for me to kick us off? Okay, excellent. So today's meeting, before we get started, I did want to advise that if you aren't speaking, it's really helpful if you mute your microphone. That will help avoid any sort of reverberation in the audio quality. Also, if you have questions or information you'd like to share, please either use the chat or use the raise the hand function, which is a little hand icon up at the top if you haven't used Teams before. And if you joined us at the very beginning, you know that we are recording this meeting, and the purpose of that is for those who missed the meeting or those who might want to watch it again. We will post the link to the YouTube video on the ASSP chapter webpage, which is listed under chapter highlights. So if you've missed any of the previous meetings, you're welcome to go back and watch those videos in all our awkward glory. So it's good fun. Don't miss out on that. All right, so before we start, let me just make sure our speaker, Mr. Jeff Carlson, are you ready?
Oh, sorry, I didn't have a responsiveness issue, but I'm ready now.
Okay, excellent. Hi there. So today we have Jeff Carlson. He's from OR-OSHA, technical specialist in the Salem office, and here to talk about COVID-19, what everybody's talking about. So Jeff, floor is yours. Thank you for joining us.
Hey everybody, just a little bit of background about me. My name is Jeff Carlson. I am a safety specialist. I am not an industrial hygienist. I did volunteer to do this though because I wanted to speak to you guys. So there may be questions that I need to take back to my group if people have them, but with Michael Wood being on, some of those questions will be answered because he's got quite a memory. So that'll help streamline it. Thank you for attending, Michael. The presentation I'm going to give you guys was created by Matt Kaiser. He is an industrial hygienist that works in my section, and he is the lead on both the temporary rule and also the rules that we're going to talk about that are coming out soon. So me being a safety guy, what I tell people is I'm not really a scientist so much as I tell people to not put their hands in flywheels. So that's my scientific disclaimer right there. So some of the things I talk about, I'll kind of gloss over that are in this presentation because they're a little bit above my competency. But I'll go ahead and get started, and I'm going to share my screen.
I see it.
I have to do that Okay, there we are. All right. Sorry,
Looks perfect.
Yeah, I had to unplug and I'll have to replug my auxiliary monitor. All right, there we are. Okay, so just starting out, we'll talk about first the temporary rule that we have in effect right now, and I'm going to have the rule up on my other screen so that if anybody has any specific questions, I can give them the reference quick, fast, and in a hurry.
Excellent. We were on the umbrella screen. I just didn't know if you knew what screen we were on. Now we're on the rule screen.
Oh, so you guys see the rule right now?
Yep.
Okay. Well, I might not be able to do that then if it's going to keep referencing itself over to the wrong screen. I've talked about little else for months though, so I'll be pretty up on it, and Michael can help me as well. So just to get started on this, are we seeing the right screen now, COVID-19?
Yep, looks perfect.
Okay,
Yep.
Great. So the agenda, part one, we're going to talk about the temporary rule. We'll get into some of that. Not too deep though. We'll just talk about some of the important things. The part two stuff is my disclaimer. We'll talk about the data and the statistics. I updated that stuff, but the vaccine and how it works is a little beyond me. I don't feel comfortable going into it or even trying to, but those questions are pretty easily answered on the governor's website, or else we could write Mr. Kaiser some emails and ask him some questions if we have any about that. And then where we're headed next is going to be really helpful for Michael Wood to be online. I have some information about kind of what the general framework is going to be for upcoming rulemakings related to infectious diseases, but the nuts and bolts are still a little bit too far out to really share. The temporary standard, we have the all workplaces, and then we also have the exceptional risk workplaces. So all workplaces is going to be everybody. It doesn't matter if you're a construction company or a forestry company. It applies to everybody. So those divisional rules and things go out the window. And then exceptional risk is workplaces where you do like direct patient care or aerosol generating procedures, such as scaling people's teeth at the dentist and stuff like that. And then there's the specific activity-specific appendices. So we have, one of those appendices has extra information about, if you're a first responder, you can remove your mask for high-speed driving if it's going to interfere with your ability to see. So it gives people different rights and responsibilities. Hello? Did I hear a question?
I don't think so. I think we had somebody who wasn't on mute.
Okay. So the appendices, I have a lot of people that will call me and they'll ask me things, I have a retail store, but I noticed this and this other appendice. Should I follow that? And my answer to that is to tell people that you can always go and be above and beyond what's recommended, or what's required, and you can find best practices. So COVID-19 is just like that, just like it always is with all of our health and safety rules. We consider our rules to be the mandatory minimum that has to be met, but going above that carries certainly no penalty. And if it's appropriate, then that is perfect. Sometimes the best practice may be a requirement, kind of in a de facto way, depending on what's going on at the workplace. There might be a situation where just following the rule isn't good enough, but that's why you guys do job hazard analysis and things like that. The main features of the rule is the physical distancing. That's actually the first rule, is to stay 6 feet apart at least, unless you absolutely can't. And then the facial coverings rules, we're all really well aware of that by now. You have to wear a mask or a face covering that meets the definition, no exhalation valve, no mesh, nothing like that. Face shields are still okay in limited situations. Sanitation has rules about how often to clean different facilities. And then the exposure risk assessment, the infection control plans should have been completed by everybody by now, but if they haven't, go ahead and get started on it. And we do have some training materials online. The training materials won't completely cover everything, but it will cover the things that are general. There's elements of that rule that require workplace specific information. And of course we couldn't, provide that. There's not enough people in the world that could update for every single workplace except for the employers themselves. And then the logistics piece of it is the medical removal for people that are either positive for COVID or the people that had a a close contact with that person, or maybe people that engaged in non-essential travel for a holiday or something like that. Quarantine and isolation, basically. And then a lot of places are trying to kind of treat COVID infections as if it's some kind of top secret information, but the rule actually requires that you protect people's medical privacy, but you have to let people know if they've been exposed, because they have to know whether or not they need to quarantine. So beyond protecting somebody's personal medical information, there's nothing about a COVID outbreak in the workplace that should be secret. It should be out in the open, and it should be addressed with everybody. Do you guys have any questions about that before I get into this? I'll move on. So the standard calls for 6 feet of distance, and that's something that's been sort of the same ever since last March. We kind of got into this situation. The rule says that they can be closer than 6 feet if it's absolutely necessary. So for people to have processes where they're within 6 feet of other people, you have to be able to justify the need for that. And if you can't, you should be honest about that and keep them apart. And I know that's kind of hard to do. People are getting better about it now. It's been so long, but we're social creatures, and it's tough to not stand by each other. So it's part of the reason why we have a rule that requires monitors on site to kind of remind people, just so they don't forget. Source control and facial coverings. Of course, we've all seen what the definitions of a face mask is. We recognize when people are wearing something that doesn't meet the requirements. You know, their nose is out, or there's an exhalation valve that isn't covered. Basically, it's got to go from above the nose down to the chin, and it's got to be one of the allowable. I want to say materials, but there's so much that's allowed that it's easier to say what's not allowed, which is going to be something like a mesh or a lace or something covered in sequins, something that basically just creates large enough openings for the aerosols that we breathe out to escape, is not going to be allowed. And the nice thing about the Oregon Health Authority's update on the last face mask guidance update was that they lined out what isn't acceptable because of all the things that we were seeing, like people wearing those South Korean chefs sneeze guards and stuff like that. So they clarified a lot, and people should be able to be on the same page pretty easily with that. Cleaning and sanitation. The nice thing about the cleaning and sanitation is that there is so much that will kill COVID-19 because it is a lipid encased virus. All you need to do is break that lipid barrier and wash it away. So one of the best things that you can do to keep this out of your workplace is to make sure that you just kill it on the surfaces as often as you need. The rule, and I don't want to misstate this, but the rule requires a couple of cleanings during the course of a day, or if you have 24 operations, 3 cleanings at least, and those will be 8 hours apart. And I get some questions about that, but I guess if you guys fall into somewhere in between, more cleaning is better. There's nothing against people cleaning their own workstation. There's nothing against people taking out their own trash, as long as it's just, an expected part of their job. Of course, if there's extra risk involved, you have to train to that. But do remember that cleaning chemicals that are used in a household manner, so like Windex on a computer screen or a plexiglass, do not require extra MSDS sheets, and they don't require extra, say, hazmat training because of those household use provisions in the rules. So pretty easy to get people cleaners and to get them to use them. Hand hygiene, we're going to want to wash our hands, as often as you can without drying your hands out. This is one of the best ways to keep yourself safe in cold and flu season or with any virus. So it certainly applies to COVID-19 as well. The exposure risk assessment. This is something that we had a lot of questions about. It was kind of a heavy lift for a lot of people, but the questions I've gotten over the course of this have really petered out. I think people that were going to do it have done it, and the people that wanted to ignore it are continuing to ignore it, unfortunately. There's 13 questions on there, and some of those are going to be very workplace specific. It requires employee interaction. You need to make sure that people understand what they're being told. So you can't just send them a PowerPoint and then check off that their inbox received it. They actually have to be able to ask a question, have a question answered if it's necessary. And then the hierarchy of controls are very important in this. Administratively, could somebody telework instead of come into the office? That's going to be, your best option. So that's pretty standard. One of the things that health and safety professionals have had a lot of trouble with during COVID-19 is the idea that this is just such an unprecedented situation for most of us. I think it's been decades since we had something similar happen in this country and had to respond to it, that we think that it's sort of a special situation, but it's not. Employment rights are still the same. Hierarchy of controls is still the same. This is just a risk situation like others. I have said in the past that as health and safety professionals, you can kind of choose your risk. If you don't like enclosed spaces, if they give you the creeps, don't go work at a shipyard. If you don't like heights, don't work for a general contractor that uses tower cranes. But there's some things that you just can't control, and this is going to be one of them. But we can apply our professional tools to it just like we can anything else, and we'll give our people better outcomes that way. The infection control plan is broadly similar, but it goes a little bit more in depth, and it gives you more of a plan to be more proactive rather than just avoid. And it has the exceptional risk workplaces requirements too. So that's going to be for the people that you can guarantee are in exposure situation instead of people with the other control plan with the assessment where you're just kind of saying like, what's the risk? This is saying this is already a risk that we know is present, so this is how we're going to respond to it, basically, if that makes sense. And those two things, they kind of interact together, and some places need both, not all places do. But do you guys have any questions about these before I move on? I'll move on.
I don't have a question, Jeff, but I noticed that Chelsea pointed out that there's a fillable form on the OSHA website. So if anybody needs that, it's linked in our chat.
Oh,
Thanks,
excellent.
Chelsea.
Yeah, thank you, Chelsea. All I can see right now, because I had on my other screen, is my PowerPoint. So interrupt me if there's questions or anything like that. And we do have a lot of great resources. Our public education people moved at a very quick pace to get these things ready, and our poster and things like that. So a very agile section put together some very good information for us on that. For the employee training for the standard, there's the 10 elements. Some of those are workplace specific, and some of them we do have training on, but you can't rely on our training entirely for them. There's some proactive work you have to do. Matt said that management ownership buy-in are mission critical, and that's true. It's kind of the exact same thing as having a functioning safety committee. Everybody has to be in on it, and everybody's got to be sharing ideas and looking for best practices. And then, of course, that last bullet, the resources available that Chelsea provided for us. If you haven't looked at that page, you'll find a lot of great stuff on there that'll make your job a lot easier with this standard. The infection notification stuff, I mentioned that there's a lot of workplaces that want to act like this is, GS-15 top secret stuff. Somebody's exposed or actually gets COVID, and that is absolutely not true. Exposed workers, the reason why that is in its own kind of bullet is because there is a definition for it, and that's somebody who's been exposed to somebody with COVID-19, and you have to let them know, you were exposed, and that is going to follow the CDC definition of a close contact. That's going to be 15 minutes cumulative during the day, whether or not you're wearing source control measures or not. Anecdotally, I know that some places are trying to put people into respirators and saying that they don't have exposures because they were, in a respirator. And that might be something that Michael can chime in on. Our rule specifically says whether or not source control measures are available. And then affected workers is going to be people that weren't in a close contact, but people who were in the building or in the area or the section that person works in that had COVID-19. And they need to be told that this is what's going on and where it was and things like that, just for their own information. There is a template that we have online. That's that last bullet point. That's going to be one of the things that's on the page that Chelsea shared, so that you guys don't have to try to create your own internal documents. You can do documents that we have and just change them to what you need. And then that bullet about confirmed by positive testing, a lot of the infection notification stuff really depends on interaction with professional healthcare personnel or contact tracers from a county health department. We don't expect employers to pretend to be medical doctors. You know, even if they played one on General Hospital for a couple seasons, we know that doesn't make them a doctor. So getting medical professionals involved is a very important part of this entire thing, because it gets you the scientific knowledge that you need in order to keep the people safe that have been exposed or could be. Medical removal is a big one. It says triggered by public health agencies or a medical provider. I mentioned, say, non-essential travel earlier in this talk. We have a travel advisory with Washington State and California. Most people know that. And it asks for a quarantine period of 14 days if you've done non-essential travel. So if somebody flew out of the state or out of the country to visit relatives, when they come back, they need to quarantine for 14 days unless they fall into one of the things that the Oregon Health Authority has said can shorten the quarantine window. And there are a couple options for that. It's kind of outside the scope of this, but it's worth looking into. Or a medical provider. And that's going to be something like the positive test at the doctor's office or something like that. So it's pretty wide ranging. Just any time that the Oregon Health Authority, a county health department, or a medical professional tells somebody that they need to be removed or that they should be removed, then that's what needs to happen. The remote working during isolation or quarantine is an important part of that. If you have somebody that can work from home, they don't need to take vacation or sick leave or something like that, because they can still be productive for you and be on the clock. They just won't be at work exposing their coworkers. And where it says this does not require a COVID-19 test, that is for people, like I said, that traveled out of state for non-essential reasons, or people that were in close contact with somebody that has COVID-19. And the reason why it does not require a COVID-19 test is, one, people can be contagious before the test would be positive, basically. So relying on a test is sort of a lagging indicator at that point. It shouldn't be relied on, because at that point the damage could be done already. Let's see, I looked this information up earlier today. The only difference between this map that Matt put on and the map this morning is that Coos County is now extreme. There's a couple other differences, but that's the only one that's in you guys' area. So Douglas County is still high, Coos County is extreme, and the rest of those places are extreme as well. I updated this data this morning. This is for Oregon, and I have been kind of heartened. I hate to say it, but I've been a little bit heartened by the fact that our deaths are climbing slowly compared to other states. I'm from Idaho, and Idaho, with a population 1/3 as much as us, passed us in total deaths about a month and a half ago. I have an aunt that works at a hospital in one of the counties that's very hard hit in that state, and I feel good about living in a state that takes proactive measures to keep people safe, I guess is why it's heartening. Not the deaths themselves, but I like that we're not trending higher, that it could be worse, but we're doing a good job keeping people as safe as we can. And then the vaccine tracker, it's going to be a while. I don't expect that I'll be vaccinated probably before the end of the summer at the earliest, just because I don't have any underlying conditions and I'm not like an essential worker like a utility person is, or a hospital worker. So I'd like to see those numbers going up faster, because I'd like to go out and eat at a restaurant, but that's what we got so far as vaccinations goes. We are getting now into the science of the vaccine, and these are the things that I'm not really that comfortable talking about, so I'm just going to kind of go through it. I'll spend a couple seconds on each page, and then people can go back in the recording and they can kind of like look this stuff up. I think is probably the easiest way, or to shoot me or Matt an email, and we'll get you an answer if you have questions about it. And then part 3 is the part that I'm going to rely on Michael Wood's expertise for. And our temporary rule is going to expire May 4th. That is a feature. It's not a bug. Temporary rules are expected to only be in effect for a certain amount of time. That's by statute, and they can't just be extended. The statutes assume that if you need to extend an emergency rule, that you should probably conduct rulemaking and put those rules in place. And that's exactly what we're doing. We're going to make 3 rules, which are...
So this may be a good place for me to jump in, because the plan actually changed last week.
Well, would you like to speak to the slides, Michael? And if you just tell me slide or next slide, I'll go through it for you.
Yeah, so we've as Jeff noted, the temporary rule can only be in place for 180 days. And so given that the COVID issues are not going to be gone magically on May 5th, I'm sorry if anybody had thought otherwise. We do need to have an ongoing COVID rule. We have, at the request of the rulemaking advisory committees who have been working with us, we have set aside, at least for the time being, any broader infectious disease rulemaking. So the rule there described as FLIC and as EPIC, and the Division 4 version of EPIC, those rules will not be moving forward at this point. What we are doing is adopting a permanent rule, and I think this is probably what the next slide talks about, but a permanent rule that's addressing COVID-19. And so it is legally permanent because we don't have the opportunity to continue to have a temporary rule, but our intention will be to repeal it at the point when COVID-19 no longer represents a meaningful threat in the workplace. And so we're in the process right now of working to figure out if there are, or what modifications there are to the temporary rule that we want to propose, and we'll be looking at making those proposals next week. It looks like everything else you've got on your slides are actually talking about the ongoing permanent rules that we're not going to be moving forward with at this point, Jeff.
You're right. Matt produced that before the 5th, and I hadn't heard about the changes, Michael. So.
Yeah, it's it literally happened over the weekend before last, and then was acted on by the advisory committees last week. So it's relatively late breaking news, and I'm sorry that we didn't get the word to Jeff so that we could modify the presentation.
I guess that sort of brings us to the end of it then, since we're not going to talk about those slides, but I'm available to take questions. I'm not sure your availability, Michael, but I know you'll have the best answers.
I am happy to hang around.
All right, and I'll tell you there's one question in the chat from Chelsea, which says, do you think masks will be the new norm for all workplaces even after COVID-19 isn't a threat?
No. I think they'll be the norm longer than some people hope, because it'll be a while before COVID is not a threat. And I certainly think that there will be a shift in societal practices that probably will result in more people continuing to wear facial coverings. But they certainly, the idea of a mask mandate or anything required like that, I certainly don't expect to be an ongoing expectation.
Excellent. Looks like we've got another question in the chat. Does the same 24-hour notification window apply for affected workers?
So the 24-hour notification, there are 2 different levels of notification for exposed.
I can answer that, Michael.
Okay, go ahead. Are you talking?
Oh, no, okay. Yes, it does. If you guys look at OAR 437.0.
Your audio is going in and out, Jeff. I think that might mean you're on the hook, Michael.
Yeah, so I won't necessarily have the rule right at my but the short answer is yes, the requirement does apply. Probably means that earlier when folks thought that he was just clicking through the slides and not actually speaking to them, he probably was speaking at that point.
That's probably true. We thought we troubleshot all those technical problems. So I can tell you my organization's been working under that 24-hour window. So we did those notifications in 24 hours for people who did not meet contact tracing, which I think means affected workers.
Yeah.
Okay.
Yeah, the contact tracing is pretty similar to the requirement for exposed workers.
Okay. Is there any other
This is
questions?
Jeff Carlson. Oh,
Hi,
hey,
Jeff.
Christy, I'm back now. Something messed up with my computer and closed the window.
It happens. Michael took a shot at answering it. Do you want to? He said yes. The 24-hour window applies.
Yes, that is correct. And the rule reference, if anybody wants to make a note, it's on page 14 of the temporary rule, and it's OAR 437-001-0744 3 India Juliet Alpha 3IJA.
Jeff, do you want to read the number again, and I'll put it in the chat?
Oh, certainly. Or it's going to be 437-001-0744 parentheses 3 parentheses little I parentheses large J parentheses large A on page 14.
Got it. Looks like we've got a hand up from Demetra Starr. Demetra?
Yeah, can you explain the difference between the disinfecting that you have to do after somebody comes up positive versus the sort of daily disinfecting that's required?
So I'll go ahead and take that. The short answer is daily disinfecting is not required in most contexts. It's a little bit different in healthcare. Daily cleaning is required, and it actually can be done with just soap and water. It doesn't have to use a disinfectant.
And then I did have a second question having to do with determining if a COVID positive case is recordable. Does it have to meet the other criteria for recordables? Meaning, do you have to have treatment, etc.? Or
Yes,
is just positive enough?
Nothing in this rule changes the COVID-19 recordability requirements. So I mean, federal OSHA has put out some guidance on that. You still need to determine that it's work related, and it would need to, I guess, I'm not sure how you'd get the diagnosis without some level of medical treatment, but I suppose if you did, then it wouldn't trigger the recordability requirement.
We've had cases where, somebody who was exposed gets tested, gets quarantined and tested, and is totally asymptomatic, but comes up positive. That would be an example of no medical treatment besides the test.
I guess you're right. The test itself, since it's limited to diagnosis, would not qualify as medical treatment. So I think you're right. I'd be more comfortable if Dave McLaughlin was on this call to confirm it, but he's not.
Well, I can speak to that a little bit, Michael, because it's something I've looked into a few times. And the long and the short of it is you'll almost never have a reportable COVID-19 case, because usually nobody's going to die within that period of contracting it. And the recordability is going to be kind of the same way. it would be worth double checking the Division 1 rules and looking at that information that Federal OSHA put out, but it's going to be really rare that it's recordable at all, and it's going to be quite rare, if not impossible, that it'll actually be reportable.
As a fatality, I think you're correct.
Right, yeah, that's what I
could
think.
end up being reportable as a hospitalization.
Well, and as we can see, this is complicated and it's ever changing. So never be afraid to reach out to your friendly neighborhood Oregon OSHA consultant and ask for some advice on how to navigate that. I'll also tell you there's another question in the chat from Jason, and it says, with the increase in employees working remotely, is OSHA seeking an increase in complaints regarding remote work site accommodations? If so, are there areas that seem to be appearing more frequently?
The answer is actually no. About the only complaint we get related to telecommuting has to do with its availability. And that's people who are still being expected to report to the workplace. And but no, we haven't seen a dramatic increase in complaints about the equipment or the adequacy of the workstation in the home working accommodation. Those are fairly rare anyway, because workers tend to view themselves as responsible for that environment. And so I'm not sure we've received we've received about 3,600 non-COVID complaints in the last 10 months, and I can't swear that there isn't one in there that addresses that, but it certainly hasn't been a trend.
Excellent. And I see that Jim Nesser linked the revised enforcement guidance for recording cases of coronavirus disease from, it looks like Federal OSHA, into the chat in case you need it. Are there other questions? Anything that's happening in your workplace you'd like some to talk about or share, that's a challenge that you'd like some guidance, or anything you'd like to share with the rest of us that's maybe a best practice we could learn from?
Hello?
Yes.
Yeah, just the best practice that we've been utilizing is HEPA filters in our workspaces. And we've had some good feedback from the employees. We're using the Dyson HEPA units that we're putting in some areas just as a backup for the HEPA filtration. And it's been received very well. So just an idea that we've instituted. We changed all the filters in our trailers and put in HEPA filters and run them 24/7. Thank you. We're all trying out here.
That's great. It sounds like those employees probably feel pretty cared about too. So that's great. Thank you. Anyone else? Jason?
I think I might have my sound fixed, so I'll try it this way. So wanted to just double check on, I know there are some people that are wanting to purchase the, I think they're the P100. You can get them by 3M, cartridge disposable face masks, just as their own personal, they prefer that over like the face coverings, makes them feel more comfortable. But there's been some debate about the fact that those may not be allowable, if they do it voluntarily, but the other end is the fact that they have a one-way valve which allows you to exhale, but it doesn't filter any of the air going out. Any information on that?
You want to take it, Jeff, or you want me to?
Well, yeah, I can speak to that. That exhalation, valve that's on that is roughly akin to like the valve that you see on some of the face masks that, let me turn on my video. The face masks that they sell that are really for people to wear to not breathe in pollen when they're running and stuff like that. It is allowing unfiltered aerosols to escape out into the environment, and it does a great job of protecting that person, but it defeats the purpose of the face covering guidance in that you're not protecting the people around you. So the thing I'm not sure about is that I know that Matt Kaiser is reaching out to some manufacturers to find out if it would be okay to put cloth over those valves so that they provided better protection on the in-breath, but also provided that function on the breath out. And I'm not sure if I don't think the PPE manufacturers, I don't think they want to touch that. So I don't think you got a satisfactory answer back. But as it's designed, it defeats the purpose of the rules. So it wouldn't be okay by itself.
All right, thank you for that. Other questions? Jason, I assume your question got answered. Your hand's still up.
Nope. I'll take that down.
Awesome.
So it looks like Jim has a question in the chat box.
Excellent. Let me get back to the chat box. All right, Jim's question. With the permanent rule now going to focus on just on COVID as opposed to a broader infectious disease standard, do you anticipate significant changes in the permanent rule compared to the temporary rule, or is it too soon to tell given the recent pivot in rulemaking approach? Good question.
So that's literally what we're working on right at the moment. But I mean, the short answer is we don't anticipate significant changes. There probably will be some changes. Of course, significance is sometimes in the eye of the beholder, but we aren't looking to make dramatic changes to the rule. You know, there are areas of sort of ongoing concern, even now, with the new strand out. I mean, we've become increasingly concerned about aerosols, and of course, the last month or so has heightened that concern even more. But even with that understanding, I don't expect that what we'll be proposing next week, right, is going to be a significant change to the existing temporary rule, except with regard to temporary worker housing.
What about vaccination? Are you guys
That's one of the areas we've had some questions about, and we may propose addressing vaccinations either in exceptional risk, or we may look at a general requirement that is comparable to the testing requirement that's in the rule now. Those vaccinate, if there's any place where we'll sort of beef something up based on more recent developments, it will be vaccinations. But we obviously can't simply require employers to make vaccinations available when we don't know the exact timeline of when the employer would even be able to do that. So there still are some challenges around that.
I would prefer to see something where it incentivizes vaccinations rather than mandates it. One thing that we're considering is the need to quarantine and get tested if you've been exposed, of waiving that if someone completed the vaccination plus 2 weeks.
I should be clear that if we required vaccinations, it would not be requiring employees to have them. It would be requiring employers to offer them. It's long-standing in OSHA law that there's an opportunity for an employee to decline any medically invasive procedure, and that would include a vaccination. And I say that not because I have any hesitation about whether people should get the vaccine. It's just an established principle. They should get the hepatitis vaccine too when it's indicated, but not everybody does.
Thanks. That was an important clarification. Any other questions, comments, challenges you're having in your workplace, or best practices you'd like to share about what's happening in your organization?
It's not a best practice, but we're really struggling with the combo of safety glasses in the construction field, with safety glasses and face covering, and keeping the glasses from fogging, keeping the glasses on them, keeping the face coverings on them. And then the added issue of when it's raining, since in construction we're often outdoors. So I don't know if anyone has any good ideas that have worked for them for overcoming that challenge.
So I have found that when I'm having issues with my glasses or when their temperature changes, that these expandable disposable masks work a lot better with my glasses because I can really tighten the clamp on the bridge of the nose. And then I know there are some people who've had some luck with anti-fogging treatments on the glasses, but I don't think anybody's completely managed it in all environments. And of course, we have a number of environments where fogging up your safety glasses are an issue even without wearing a facial covering.
All right, looks like
Can
we
I
have a
add
hand
something
up.
to that?
Go ahead, Jeff.
Oh, I just wanted to add something to the anti-fogging issue. For hot processes, like say welding, a lot of people don't really realize it, but the welding hood is actually its own face shield. So, there's an opportunity to follow the rule without worrying about the fogging. And you can also do things like medical tape across the bridge of the nose and things like that, as long as there's not an arc flash issue. So you can add things to the face mask to make it more ergonomic or more protective as far as your eye protection goes without compromising its ability to protect the people around you. So there are some like add-ons like that. I just wanted to mention that since it was part of the topic.
Great advice. It looks like we have a hand up from Mark Walker.
Yeah, I just, on the eyeglass issue, we worked with our PPE provider and they found me some glasses that are specifically designed for not fogging up. And first tests seem to be pretty successful. So they're, talk to whoever you're getting your PPE from. They may have something that they brought in just for that.
Hey, Mark. Hey, I
Yeah.
just was curious, what brand or provider are you using for that? Because it's been an issue with some of our guys too. Yeah,
I worked with Fastenal on this, and the glasses brand that they suggested that we're testing is Boll, B-O-L-L-E.
Okay, thank you.
And if you just shoot me an email, I can give you my Fastenal contact's name. And who knows, maybe I'll get a discount because I've given some business. They're not cheap. They're $7 a pair, but then, comparative, that's probably well worth if I can keep people to wear them.
I'll actually comment on that. We've done a lot of work with that, and so have we with a bunch of our other contractors here in the Mid-Valley. And Bullies is actually, we found some pretty good success with those, and we've tested everything. The hex armors, which are about $9 a piece, actually, the hex armors are doing pretty well, and those are the two best. Honestly, don't have any stock in either one of them, but for that first comment, I would also throw out that the Bullies and the hex armors, what we're seeing, are helping. Everything, it is a huge challenge. They're helping. That and get the wipes, get the lens cleaners when you get them. What I'm finding is if we get the actual nice wipes, is in my vest, that helps because they've got a way to clean them, and they'll send those from the vendor as well. Thanks.
Is that an anti-fogging wipe, Lane?
No, it's just actually like a micro wipe, like you get at the optometrist. Just a
Okay,
little,
like a microfiber?
like a little 3x5 that they can keep in their pocket. I keep one in my vest. Well, I'll grab it while I'm on mute, and I'll show it in a second.
And we have the little packets of lens cleaners that help with the fogging issue also.
We've used those quite a bit, and we are using the anti-fog wipes in the little packs, but that's the hex armor wipe right there. So just a little 3x5. It's got their logo on it. Thanks. That's the best. We're all fighting it. So just to the OSHA guys, we are working this, is keeping us up on overtime. Thanks.
Awesome. Thanks for that. Thanks, Mark. Thanks, Lane. All right, looks like we have a question in the chat, and this I think is probably to Mr. Michael Wood, which is, how has compliance to the OSHA temporary rule been across Oregon? You're muted, Michael.
That's an interesting question. You can probably answer it a little bit better than I can. We have not gotten a lot of complaints specific to the rule that we have been acting on, partly because right as the rule took effect, we went into the new freeze and then into the extreme risk categories. So we have been again dealing with the issue of businesses with restricted activity and not choosing to follow that. I do know that of the complaint items that I've seen, the most frequent issues related to the rule, you know, we still get kind of the mask compliance question, which is one that has been coming up regularly. We also do get a lot of issues around notification and whether it's happening timely. In a lot of those cases, it appears probably the employer is doing the notification of the exposed employees and not really handling the broader notification well, or being too conservative about the broader notification. I mean, it doesn't hurt to tell everybody. and so I think one of the messages there would be to be as broad as possible. And then there still are a lot of issues where we're getting suggestions that employers are literally requiring employees to come to work while they're being tested and to come to work even after they've been tested positive, and at least reportedly threatening their continued employment if they don't do that. Those are the two areas. I don't know yet how often that will turn out to be valid. Those are the two areas specific to the rule that I see most frequently in the complaints in the system as a whole when I've looked at them.
Excellent. Looks like we have a hand up from Christian.
Yeah, hi. So just to touch on that, when you talked about notifying the broader employees, not just the exposed employees, what is the information or notification requirements for that? Like, what type of information are we required to tell the broader affected employees? Is it just, hey, there was a case in your department, or we had a case at our workplace? Like, how broad of the information, or how specific do we need to get?
You're on mute, Michael.
I've gotten accustomed to Zoom, where it flashes on the screen, "Hey, stupid, you're on mute." So the notification, we actually have a model policy on the website. The notification for the affected employees is very basic. It really is just letting people know that there's been an incident, and that the other thing I'd really recommend is that you make it clear that you have notified those people who appear to have been exposed, because that's, if somebody's not one of those individuals, they believe nobody was notified. And so that the rule doesn't strictly require that. All the rule requires is that there was an individual who was present in the facility and facility writ large.
So Christian, I can tell you in my facility, when we're notifying, we have a campus here. We've got 21 buildings, some more occupied than others. Most of our cases, I think all with the exception of one, have come out of our most populated building where our crews operate. We made the choice to let everyone who works at this facility know, because we do pop between buildings, and we let them know the date they were last on site. So that if potentially they had an exposure that they didn't catch through the contact tracing process, they could self-identify. And I think it helped with some of the trust and confidence issues with our employees, understanding that we were taking the risk seriously and able to answer questions about how we were cleaning afterwards to make sure that the workplace remained safe for them to occupy. Yeah. And we did have one case that was really interesting where, you know, like some of our businesses are big enough that we've got people who are related. And there was someone who came down with the case while a family member was still in the workplace. And so they left and then tested and came back positive. So when we told everybody they left that day and had a positive case, there were a lot of questions about whether or not this employee used poor judgment. And so we sort of were able to defend that for them so people didn't tell themselves a story, you know, and potentially retaliate. So that's been our approach.
I'd like to throw out one thing.
Yeah, go ahead, Lane. You're a little hard to hear.
Just a question on testing. Has anyone had any really good success stories or have any recommendations? We're finding that there's such a wide range of testing. Has anybody got a good success story out there about where they're getting good results and good service in the Salem, Albany, Corvallis area, Mid-Valley? Thank you.
Doesn't.
Unfortunately it changes week to week, depending on how it's surging. So even the labs with the quickest turnaround, a week later it can be completely different. So it's hard to say.
Right. So in other words, by the silence, everybody's struggling as hard as we are with it. So if nobody else is giving me success stories, then 35 people here are struggling like we are. Thanks. Sorry.
Well, I'm a little disconnected from the testing, so I wouldn't know that piece of information. Go ahead, Mark.
Yeah, I feel like our testing's going pretty well. Our original lab out of Corvallis really got some long turnaround times, and we did a little looking around. We've been using a lab out of Portland and doing saliva testing, which my research indicates is as accurate as the nasal as far as being able to pick it up. And I'm getting, from the time of test, an average of about 48-hour turnaround. That includes the shipping. And then I'm also doing surface testing of the facilities weekly. And that's kind of as see if I catch something that we didn't know about, if you will. And I've had one positive case that we've picked up through the surface testing that led me to do testing on some individuals. So I feel like our testing program has worked out pretty well.
Yeah. Hey, this is Brent with the AGC. Hey, what's that lab in Portland? This is something. I was going to chime in there when Lane mentioned that, because we're struggling to find that. That's the fastest turnaround I've heard of. If you're getting 48 hours, that's by far the best I've heard of.
Yeah, it's Kashi Labs, Kashi.
Kashi. Great, thank you. Yeah, we're finding it's geez, you lose a few days on the front side, and the person goes in, gets tested, and then it's a few days on the back side. You end up with almost 7 to 10 days. Right. With a high dollar construction guy out of work, and the employers usually just kind of float their hours, pick up that tab, and it's adding up.
Yeah, well, I ended up having to shut my factory down for a week on the original lab because the turnaround time was so slow.
Yeah.
And so this is considerably faster turnaround. It is more expensive. We're in the $120 range per test.
Oh, that's all right. Yeah.
Yeah, and I have to pay for a doctor to kind of supervise the program. So, and imagine that doctors aren't cheap.
All right.
But they FedExed the test kits to me. I collect the sample, package it, send it FedEx next day, and I have yet to have them take longer than 24 hours after they've received it.
Is this a kit? Are you ordering a kit online or through a program for the saliva test?
If you give them a call, they'll set you up with the kits.
Okay.
But it's a kit that they send to you. The employee basically spits into a small vial.
Yeah.
You cap it and you send it back. It's not the cheapest route that I found, but it is the best one that I found so far.
Well, hey, thank you very much. I appreciate that.
You bet. Now, if they start to slow down, I'm going to deny everything and keep it to myself.
Exactly.
Way to be a good safety person and share your knowledge and your source, Mark. We also have a question in the chat that I think is for you from Eric Connolly about could you explain the process and cost for surface testing? And I think you got to part of it already.
Yeah, so the surface testing is an outfit out of Eugene. It's called Enviral Tech, ENVIRAL TECH. They'll ship you the test. They're here in town, and I just picked it up at their lab. They're out in West Eugene. But it's a test that involves 8 vials and 8 swabs. You pick some commonly used surfaces in your facility. They give you some guidance on what are good choices. So I do door handles that are used by everybody, surfaces in the break room, and the restroom facilities. You swab that, you break the swab off into the vial, and you send it back to them. And then you get a report back as to whether there was any virus detected on the surface. And then the next thing I am going to try through this same outfit, the Enviral Tech, is you can swab individuals' hands and you pool those results together. So in other words, you test basically 6 employees, they all get run at the same time. So it's not a diagnostic test. They're not licensed to be a diagnostic test facility. This is just a PCR test on surfaces. So, and that's the 2-stage program that I'm currently using.
What's the fee on that surface test?
Actually, one of my VPs is the one that signed the original paper on it, so I'm not totally sure, but we're looking at probably about $1,000 for testing. For I think it's $1,600 a month is what I seem to recall.
And how often are you doing that? You said once a week?
Yeah. I go through and test weekly.
So those, if you're doing 8 tests, if it's 400 a week, 1,600 a month, that'd be $50 a pop. Sounds like.
In that neighborhood, probably.
Okay. So yeah, how many people and how big an area is that you have to do all that 8 as a standard, or could you do 4 if you're a lot smaller facility?
You'd have to ask them. So I actually do 16 vials a week. I've got 4 buildings that I'm responsible for. So I do all 4 buildings. The largest facility, I do 7 swabs in there. My smallest facility, I only do the entrance door. And then, the other 8 are divided between the other 2 facilities.
All right. How many employees is that encompassing approximately?
We're about 135.
Okay.
135 employees. Yeah.
Thank you.
Yeah, and it looks like Eric Connolly was kind enough to put the link to Enviral Tech on our chat, and it says that the website lists the cost at $300 for 4 tests, but that's just based on a website. So thanks, Eric. All right, we're technically over time. Are there any last questions from anybody or any anything you'd like to share? Okay, I posted a couple of links in the chat as well. One was the link to the Oregon OSHA rules that Jeff was telling us about earlier. I also put a link into the free personal protective equipment for small businesses through the city of Eugene. That is by appointment. So click on that web link and it will give you the basic information on how to make an appointment as well. And I want to thank Jeff Carlson for being our presenter today. So thank you so much. And to Michael Wood for also presenting and helping us sort of deconflict and keep up with the ever-changing rules around COVID-19 and the temporary rulemaking that may become permanent in the future. Any last thoughts or any announcements, Mr. Dennis Hughes? Oh, there's Jeff. Did you want to say anything, Jeff?
Oh, I just wanted to let everybody know I put my direct email address into the chat so people can save that for a contact.
Awesome. Thank you so much. Any
Nothing
last
else
thoughts?
for me.
Okay,
Thanks, everybody.
awesome. Thank you so much. And I will, as the meeting ends, I will save this recording and have it posted to our ASSP Cascade Chapter webpage as soon as possible. Hopefully by the end of the week, it will be available in case you want to watch it again in all its awkward glory. Thanks for joining us. I appreciate it so much.
Thank you.
All right. Thank you, guys.
Goodbye, everybody.
Thanks, Christy.
Bye.